All right, so we're back for another deep dive, and today it's all about healthcare documentation and reporting.
Documentation and reporting.
Yeah, we're cracking open a nursing school lecture on the topic.
Oh, very cool.
Yeah, when you think documentation and reporting, you think, okay, paperwork, I get it, but it's actually way more than just filing those forms.
Oh, absolutely.
It's all about protecting patient privacy and making sure everyone is getting, that quality care.
It really is the backbone of a safe and effective healthcare system.
Yeah, and this lecture starts off with this study. They actually use these detailed patient records to come up with this treatment for a rare disease.
Oh, wow.
Like groundbreaking stuff.
That is a perfect example of how important it is to have good documentation and how it can actually have an impact.
Yeah, and then the lecture kind of jumps into, the legal side of things.
Oh, yeah, of course.
Which is a big deal in healthcare.
Jeez, yeah.
They actually mentioned a court case where a hospital's documentation practices really came under scrutiny.
Right, yeah, because legal cases often hinge on the accuracy and completeness of medical records.
Exactly. So it's not just about following rules, it's about protecting everyone.
Definitely patients and providers.
Yeah, making sure that that information is reliable, trustworthy.
Yeah, that trust is essential.
Absolutely. So the lecture then moves on to this evolution of documentation, and it's kind of mind-blowing how much things have changed.
How so?
We've gone from handwritten notes on paper charts to these complex electronic health records.
EHRs.
EHRs, exactly.
Oh, yeah. It's been quite the journey, and it's not over yet.
Right? Are we still kind of figuring it out?
Yeah, I think so.
Yeah, and the lecture actually points out that while EHRs have made information more accessible,
Sure, more accessible.
it's also introduced these new challenges, right?
Oh, yeah, think about it. Like with electronic systems, there's potential for errors, privacy breaches, even cyber attacks.
Right. It's like we've traded one set of problems for another.
It's a constant balancing act,
Yeah, for sure. For sure. But, that doesn't mean we just abandon them altogether.
No, definitely not.
We just have to be really smart about how we use them.
Yeah, and I think the key is to leverage technology to improve care while also safeguarding, patient privacy and data security.
Yeah, finding that balance. One thing I found really interesting in this lecture is they said that nurses are like the storytellers of patient care.
The storytellers.
Yeah, because they're the ones who are, constantly documenting what's happening.
Oh, I see. They connect all the dots and make sure the narrative is complete.
Exactly. It's not just facts and figures, it's about capturing that human element of care.
It's about documenting those subtle changes.
Right.
Those responses to treatment and their emotional well-being.
And then it takes us on this deep dive into charting styles. I had no idea it was so diverse.
Oh, really?
Yeah, it's not just about writing down what happened. It's about organizing that information in a way that makes sense.
Right, so that everyone involved can understand.
Exactly. And there are all these different approaches, right? There's like the problem-oriented medical record.
Okay.
I was really intrigued by that. And the idea is to focus on specific patient problems.
Got it.
And then you document the interventions and outcomes related to those problems.
Right. Very logical and patient-centered.
Yeah, but then there's pie charting, focus charting, charting by exception. It's like a whole language.
Right, but it's all about finding the most effective way to communicate.
Yeah, within that specific setting.
Exactly.
It's kind of like choosing the right spice for your dish.
Okay.
You wouldn't use human in a chocolate cake.
Right, different flavors, different purposes.
Exactly. And then the lecture shifts gears a little bit and talks about the role of nurses in patient advocacy.
Oh, interesting.
They're often the first to notice those changes in a patient's condition.
Right, they spend the most time with them.
Yeah, they have this responsibility to speak up even when it's difficult.
Absolutely. That's a core ethical principle of nursing.
Yeah, they actually describe a situation where a nurse noticed this discrepancy in a medication order.
Oh, wow.
And they advocated for clarification from the physician?
That's amazing. So they're literally saving lives?
Yeah, through their attention to detail.
And willingness to speak up.
Exactly, and that attention to detail is also really crucial when it comes to those nurse handoffs.
Handoffs.
Yeah, those critical moments when one nurse is passing a baton to another.
Right, like a relay race, you don't want to drop the baton.
Exactly, and speaking of handoffs, the lecture gets into the importance of clear communication during those transitions. And they introduce us to this tool called SBR.
SBR.
Yeah, it stands for Situation Background Assessment Recommendation.
I see.
It's this structured way for nurses to communicate, all that critical information during a handoff.
And it's been shown to reduce those communication errors.
Yeah, and improve patient safety.
Wow.
And get this, SBR wasn't even invented by doctors or nurses.
Really?
It was developed by the U.S. Navy.
The Navy?
Yeah, to ensure that communication was clear during those high-pressure situations.
Makes sense. When dogs are on the line, every word matters.
Exactly. And it just shows how important clear communication is, in any field.
Absolutely.
So we've covered a lot of ground in this first part of our deep dive. We've talked about legal and ethical implications of documentation.
Yeah, the evolution of EHRs, all those different charting styles.
The critical role of nurses in patient advocacy.
And those handoffs.
Those handoffs, exactly.
It's been fascinating.
It has, and there's still so much more to explore.
Can't wait to dive in.
Me too. Stay tuned because we're about to get into the nitty-gritty of healthcare documentation and see how these principles really come to life in a hospital setting.
Looking forward to it.
Welcome back. So we're, digging deeper into this nursing school lecture on healthcare documentation.
Don't get deeper.
And this time we're like stepping right into the heart of a hospital.
Whoa, hospital setting.
Yeah, the lecture uses this case study to show how, everything we talked about in part one, how it actually plays out in a real life situation.
Oh, I'd like that, case studies are a great way to bridge the gap between theory and practice.
Yeah, it's like watching a documentary versus reading a textbook.
Totally. You get to see the action unfold.
Exactly. So the case study introduces us to Miss Jones.
Miss Jones.
Yeah, she's a patient who's been admitted for acute kidney injury.
Okay, acute kidney injury.
And she's got this complex medical history.
Complex also.
She has hypertension and COPD.
Okay, so multiple conditions.
Yeah, and that means she needs supplemental oxygen.
Right, so right away you can see why documentation is so important.
Yeah, there's a lot to keep track of.
Absolutely, and her condition can change so quickly.
Yeah, the lecture highlights that, 1 minute her vitals are stable.
Right.
And the next she's showing signs of respiratory distress.
Oh, wow. That's the thing about healthcare. It's so dynamic.
Yeah, you have to be ready for anything.
Always adapting.
And that's what communication is so important.
Communication.
Yeah, in this case, the nurse recognizes that, things are getting serious.
Okay.
And decides to use SBR to communicate with the doctor.
SBR. Remember that framework?
Yeah, Situation Background Assessment Recommendation.
Like a well-oiled machine for conveying critical information?
Right. It ensures that everyone's on the same page.
Exactly. No room for misinterpretations.
So the lecture breaks down how the nurse uses SBR, starting with the situation.
Okay, the situation.
They're giving that clear picture of what's happening right now.
Right now.
Miss Jones is having trouble breathing. Her oxygen levels have dropped.
Okay.
And she's using those accessory muscles to breathe, which is not a good sign.
No, not good.
Then they move on to the background.
Okay, the background.
Giving the doctor all that context,
Like her diagnosis, her medical history, your meds.
Exactly. It's like a roadmap of her health journey.
So they can make the best decisions.
Yeah, and then comes the assessment.
Assessment.
This is where the nurse shares their professional opinion.
Okay.
Based on what they're seeing.
I see.
So they might say something like, based on Miss Jones's presentation, I suspect she's experiencing an exacerbation of her COPD.
Okay, so they're giving their professional evaluation.
Exactly. And then finally, the recommendation.
The recommendation.
Where the nurse suggests a course of action.
Okay.
Like, I recommend a nebulizer treatment with albuterol to help open up her airways.
So SBR is about collaboration.
Yeah, it's not about, just giving orders.
Right, working together to find the best plan for the patient.
Exactly. And the doctor, after hearing that SBR report, agrees with the nurse's assessment.
Okay.
And authorizes the treatment.
Good, but the documentation doesn't stop there.
Oh, absolutely not. The nurse documents everything.
Everything.
The time of the call, the content of the SBR, the doctor's response.
Right, and the new order for the albuterol.
Yeah, it's like a detailed log of every decision and action.
Right, ensuring accountability and, creating that timeline.
Exactly. And this documentation benefits the whole team.
The whole team.
Yeah, if Miss Jones needs to see a specialist or is transferred to another unit.
Everyone has that information.
Exactly. And then the lecture, it highlights this other crucial aspect of documentation.
Okay.
Which is that ongoing assessment and evaluation.
Right, you have to keep monitoring.
Yeah. After Miss Jones receives the treatment, the nurse continues to monitor her really closely, noting those changes in her breathing, her oxygen levels, her comfort level.
It's not just about documenting that initial problem and the intervention.
Right. You have to document the response to the treatment.
And any changes after that.
Yeah, it's like adding chapters to her story.
Right, so everyone knows how she's doing.
Exactly, and all of this helps, inform those future decisions about her care.
Definitely, it can reveal patterns.
Yeah, like identify potential triggers or, highlight what treatments are working.
It helps you see the bigger picture.
And the lecture points out that, documentation goes beyond just those clinical aspects of care.
Beyond the clinic.
Yeah, it's about capturing those small but important details.
Okay, give me an example.
So like the lecture mentions, before the nurse leaves Mrs. Jones's room, she requests a bedpan.
Oh, okay.
It seems like a minor detail.
Right.
But it's important for her comfort and dignity.
Right. Documenting these requests ensures that those needs are met.
Yeah, it's about seeing the whole person,
Absolutely.
not just the illness.
The human element of care.
Exactly. And speaking of the human element,
Okay.
the lecture dives into those nurse handoffs.
Handoffs.
Yeah, those transitions when one nurse ends their shift and another takes over.
Right, those can be tricky.
Yeah, they're often cited as, those high-risk periods for communication breakdowns.
Right, because if critical information is missed...
Oh, it can have serious consequences.
Definitely.
The lecture really emphasizes that these handoffs shouldn't be treated casually.
No, they need a structured approach.
Yeah, and a clear communication strategy.
And guess what? S-bar comes back.
S-bar is back.
It's not just for talking to doctors.
It's for nurse-to-nurse communication, too.
Wow, so versatile.
Yeah, it's like that universal language.
Everyone's on the same page.
So the lecture walks us through, those best practices for nurse handoffs.
Okay.
They highlight the key elements of a bedside report.
Bedside report.
Which is like the gold standard.
I like that term, bedside report.
Yeah, because it emphasizes that this communication is happening.
In the presence of the patient.
Exactly. They're involved.
It's about transparency and empowering the patient.
Right. They're part of the team.
I like it.
So the lecture explains, a good bedside report starts with, that basic identifying information.
Like their name, date of birth, reason for admission.
Yeah, and then the nurse provides that concise summary of the patient's current health status.
Okay, current health status.
Like their vital signs, any changes in their condition.
And medications and treatments.
Exactly. It's like a mini version of their chart.
Highlighting all the essentials.
Yeah, and the nurse also reviews any outstanding orders.
Okay.
Like upcoming tests or procedures.
Uh-huh.
And addresses any concerns that have been raised.
By the patient or family?
Yeah, it's all about, ensuring that continuity of care.
Making sure nothing falls through the cracks.
And then to bring it all together,
okay,
the lecture revisits Miss Jones's case.
Okay, back to Miss Jones.
Yeah, and they show how a bedside report would be conducted in her situation.
Oh, this is great.
Yeah, and the nurse just seamlessly weaves together all the relevant information.
All the details.
Yeah, her condition, the respiratory distress, the albuterol treatment.
Wow, even her request for the bedpan.
Yeah, they paint this really clear picture.
So the incoming nurse is fully prepared.
Exactly. And the lecture emphasizes, it's not just about reciting facts.
Right.
It's about conveying those nuances, her emotional state, her level of understanding.
Her concerns, her preferences.
Yeah, treating her as a whole person.
Exactly.
And to wrap up the bedside report, the nurse highlights any outstanding tasks.
Okay, tasks for the next nurse.
Yeah, it's like passing the torch.
Ensuring that seamless care.
Yeah, this walkthrough of the bedside report just really shows how important clear communication is.
Absolutely.
During those handoffs.
It's a testament to those nurses.
Yeah, they're amazing.
Navigating these transitions with grace.
Yeah, making sure the patient safety is never compromised.
Never compromised.
But our deep dive isn't over yet. There's still more to explore.
More to explore.
When it comes to this, ever-evolving world of healthcare documentation.
I'm ready.
Stay tuned for part 3, where we'll tackle those complex electronic health records.
HRs?
Yeah, dive deeper into those charting styles.
There's charting styles.
And explore that ongoing quest for, improvement in healthcare documentation.
Can't wait.
Okay, so we're back, and we've saved the best for last, right?
The best to last.
Those electronic health records, the EHRs.
Yeah, EHRs.
They're really revolutionized healthcare, but let's be honest, they can be a bit of a headache.
Oh, tell me about it.
The lecture actually starts off with this case.
Okay.
Where a hospital's EHR system crashed.
Oh, no.
Yeah, they had to go back to paper charts.
Oh, wow. Talk about a throwback.
Right. It makes you realize how much we rely on these systems.
And how vulnerable we are when they fail.
Yeah, and the lecture actually mentions this study.
Okay.
That found that EHR glitches are like one of the leading causes of medication errors.
Oh, wow. That's scary.
Yeah, that's a big deal.
It is. Technology isn't foolproof.
No, it's not.
And we have to be aware of those risks.
Yeah, for sure. The lecture goes on to talk about some specific examples.
Like what?
Like those copy and paste errors.
Oh, yeah, those are so easy to make.
Yeah, you accidentally copy info from a previous entry.
And it's outdated or inaccurate.
Exactly. It's like using a template, but forgetting to update the details.
Yeah, you have to tailor every entry to the individual patient.
Absolutely. It's about personalized care.
Not just data entry.
Right, and even with the best intentions, mistakes can happen.
Of course.
So the lecture talks about how important it is to have clear procedures for correcting those errors.
Right. What do you do when you make a mistake?
Yeah, like imagine a nurse accidentally documents the wrong medication dosage.
Ooh, that's a big one.
Yeah, and you can't just delete it.
No, you have to document the mistake, the correction, the reason for the collection.
It's like those track changes in word processing.
But with much higher stakes.
Yeah, exactly. And speaking of, transparency.
Transparency?
CHRs have raised these questions about patient privacy and data security.
Right. Who has access? How is it being used?
Yeah, those are big concerns.
Stakes.
And the lecture actually mentions this case where a hospital was fined.
Fined for what?
For inappropriately sharing patient data.
Oh, wow, with a third-party company.
Yeah, so we need strong privacy policies.
Absolutely, strict regulation.
To protect that sensitive information.
It's a tough one, you know?
Yeah, finding that balance.
Between using data to improve care,
Right.
but also respecting patient privacy.
It's a tightrope walk, for sure. But let's not forget about those different charting styles.
Oh, yeah, those are still important.
Yeah, the lecture reminds us that even with EHRs...
Those fundamentals of clear documentation are crucial.
Exactly. It doesn't matter the medium.
Right, the principles are the same.
Whether it's problem-oriented or pie charting.
The goal is to tell that patient's story.
Yeah, and I was really interested in charting by exception.
Charting by exception?
You only document what deviates from the norm.
Oh, that sounds efficient.
Yeah, but you have to know what normal is.
Right, for that specific patient.
Exactly. You don't want to miss anything important.
No, definitely not.
You have to be a detective.
The detective?
Yeah, putting all those clues together.
Building that narrative?
And sometimes those clues come from unexpected places.
Like where?
Like those verbal or telephone orders.
Oh, yeah, those are tricky.
They should only be used in emergencies.
Right, when time is of the essence.
But even then, they have to be documented and verified.
Double-checked.
Yeah. And the lecture tells the story about a nurse who received a verbal order.
Okay.
And something didn't sound right.
Uh-oh.
They trusted their gut, double-checked, found a dosage error.
Wow, that could have been really bad.
Yeah, so it's about critical thinking.
And attention to detail.
Yeah, speaking up if you have concerns.
Absolutely, being a patient advocate.
Exactly. And speaking of advocacy, the lecture also talks about incident reporting.
Incident reporting.
Yeah, it's so important for safety.
Right, we learn from our mistakes.
Yeah, identify patterns and prevent future incidents.
So it's not about blame.
No, it's about finding solutions.
Making things better.
Yeah, and that brings us to the end of our deep dive.
Wow, what a journey.
It really has been. We've explored so much.
The history, the challenges, the innovation.
Those human stories.
It's more than just paperwork.
Yeah, it's the foundation of good care.
Telling the patient's story.
Making sure their voice is heard.
And it's always evolving.
Always.
So the next time you're in a healthcare setting,
yeah,
think about all that documentation behind the scenes.
It's working hard for you.
And if you're curious, ask your provider about their practices.
Knowledge is power. Thanks for joining us on this deep dive.
It's been a pleasure.
We'll see you next time for another fascinating exploration.